Yes, good evening. How are you? Welcome. Don't throw me, you're going off. No, no, good evening, everybody. How are you and welcome? I'm live on Facebook, I'm live on YouTube, and I'm live on TikTok. Good evening, and how are you? So, if you are joining me from TikTok, say hi. I can see you all here. Good evening. Call my name, or I will go off. No, you're not going off. Good evening. We are live on YouTube, Facebook, and TikTok. How are you? We have Dr. Viva in the house. We have Dr. Timitokbe in the house. We have Dr. Snowizi in the house. This is awesome. See, Doc, may I send you link? May you join me for YouTube? Should I send you the link so that you join me on YouTube? Good evening, everybody. If you can hear me, say hi. Yes, I can see you. Who is here? Osereme Michael. Good evening. Osas is here. Good evening. Good evening. Good evening. Yes, good evening, everybody. Welcome. Stella, send the link loud and clear. Okay, let's do this. Give me other phone. Give me other phone. Let me see if I can get the link. How do I get the link? Okay, let me invite. Let me get the link. Hi. Good evening, Udeme. This is interesting. Oh, I have four doctors already me on TikTok. Please talk to me. Let me know that I'm concerned. Pat, how are you? Ladies and gentlemen, you can join me on YouTube and Facebook. Yes, you can see me live. Good evening, doctor. What can I do to get weight? Sarah says, what can I do to get weight, please? It's urgent. I dey eat well, but don't get fat. Okay, Sarah, it's not urgent, madam. This is not an emergency. So there is no panicking here. Do you understand? There is no panicking, and to add weight, we'll tell you to eat your normal food. Eat your normal food, and let me go to YouTube. Yes, move over to YouTube or Facebook. Move over to YouTube or Facebook. We'll tell you to eat your normal food and continue your life. If you eat your food and you don't add weight, it means that you're not going to add weight, madam. You understand? How do I get this link to you guys? How do I get this link? How do I get this link to you guys? Dr. Timitokwe, how can I measure my BMI? How can I measure my BMI? Muritala Abiola, to measure your BMI, you need your weight and you need your height. How can I get this link to you now? I need to do this. I need to do this. How do I get the link to you? Voila. Okay, let me do it here. Let me copy the link to you. So you need your weight and your height. You need your weight, you need your height. And then you should know your weight, your height. Your height must be in meters. What's your YouTube name? Doctor Fredostar. For those on TikTok, go to YouTube, type Dr. Fredostar. You will see me on YouTube or Facebook. How do I get this link to you people right now? I want to send the link to Dr. Timothy. I want to send the link um, to Dr. Timothy and the rest. Okay, good. So you need your weight and your height. Your name is what? Your name is Muritala. Yes, yes. I've answered you. You need your weight and your height. So you know your weight, your height must be in meters. Then you do what? This is going to be hard for me tonight. Okay, I'm trying to see if I can add some people here. I want to bring them here. Then you multiply your height in meters. You multiply your height times the same value. Whatever you get, you divide it by your weight. You divide your weight by that value. What test would you recommend for couples about to get married? Check your genotype, check your blood group, check HIV, check your blood sugar. Um, for the men, you can do a seminal fluid analysis. You can do a seminal fluid analysis. You can also do um, sexually transmitted infections. You can screen yourself for STDs. Hmm? Very important. You can do that. Okay. For those on TikTok, you are welcome. You are welcome. Those on TikTok, you are highly welcome. Yes, I see you. Janice is here on YouTube. Janice, I see you. Hmm? Janice is finally here on YouTube. Welcome. Ladies and gentlemen, we are live on YouTube and Facebook, and I want to do something. I want to add some of my chiefs. I want to add them on. I want to add them on the YouTube link. Okay, okay. Let's see. I'm trying to bring them up here. I'm trying to send them the link. We have about 3 doctors already on this live stream. It's quite interesting. Okay, so many questions pouring in. I just wish that I can have them here. Okay. Good evening, doctor. Why is Staphylococcus aureus not going after taking all kinds of treatments? And all the treatment taken is from the test, the drugs that have sensitivity I use but not working. Praise, did you see a medical doctor? Did you see a medical doctor? Praise, tell me. Yes or no? Did you see a medical doctor? Grace is asking us, how do you know your BP is high? How do you know that your BP is high? You know your BP is high by checking your blood pressure. You know your BP is high by checking your blood pressure. That is how you know your BP is high. You check, and when it's above normal, above 130 over 90, people will tell you 120 over 80, but get to above 130 over 90. I'm trying to get this stuff here. I didn't plan for this, but let's see. Um, Hepatitis, yes, yes. Check yourself for hepatitis. Screen yourself too for hepatitis. Very important. So if you're about to get married, check your blood group, check your genotype, screen yourself for HIV, hepatitis, blood sugar for diabetes, STDs. What again? Okay, I'm almost there. I'm almost there. I'm almost there. Okay, Dr. Temitope, I'm sending you the link right away. Dr. Temitope, I'm sending you the link on WhatsApp. I'm forwarding the link to you on WhatsApp. Let's see. Let's see. I'm forwarding the link to you right now on WhatsApp. You should be getting the link to join us here. Okay, I've sent it to you. Yeah, I've sent it to you. So join here. So for those on TikTok, you can send the link also to Snoweezy. If Snoweezy is on this TikTok, you can send it to him, please. Thank you. Okay, what time in the morning is best for water therapy? As soon as you wake up, as soon as you wake up in the morning, take your water. Okay, ladies and gentlemen, welcome. We are live on Facebook, we are live on YouTube. Do not forget, please share this live stream, share the video. Don't forget to send me stars. I see you, I see you, I see you, I see you. Snoweezy, is that you? Snoweezy, is that you? Snow pace setter. Let me send you. Okay, do me. Let me send you a private message. Snoweezy. Snoweezy, chat me privately. Chat me privately. Yeah, I'm going to send it to you. Okay, good. You did. Okay, Praise. Praise said she saw a doctor and is not going. When was this? Tell me, when was this? Good evening, doctor. Please, which injection is effective for staphylococcus? Okay, we have Dr. Timotokma in the house. Yeah, let me bring him up. When you are ready, let me know. When you are ready, just tell me when you're ready. Yeah? I'll bring you back up. I see you. Okay. Um, so we don't prescribe injections, my brother. We don't do that on this live stream. Huh? I don't prescribe medications for people online. I beg you. This is not a clinic. This is just a public forum where we educate people. We don't treat people here. Yes. So, Dr. T, when you're ready, Let me know. Give me a sign, and I'll bring you up. Huh? I can see you already in the house. I'm ready. Okay, good, no problem. I'm bringing you back. Yes, Chief, how you there? Good evening.
I'm fine. Oh,
For those on TikTok, please, you have to join us on Facebook and YouTube. Hmm? You will have to join us because you will
yeah.
not be able to see me and Dr. Temitope right now. We are live on
Eh,
on Facebook. This is quite fun. This is quite fun. It's great to have my good friend and brother here. So if you have questions, he's going to respond to you. So, doctor, somebody says that she was treated for staphylococcus some time ago, but it's still occurring. What would you advise her to do?
so my question is, what exactly is staphylococcus? Or what does she mean by she was treated for staphylococcus?
Okay.
That's the question I usually like to ask people. Until she sees a doctor that gives her a proper diagnosis, I cannot work with that diagnosis. That's not diagnosis for me.
Hmm. What happened? What happened? You are muted.
Sorry, I tapped the mic. I
Okay,
tapped the
okay,
mic.
go ahead.
So
Okay.
anybody can say staphylococcus on the street. That's for those guys that stay in those big bosses in Lagos. So until she gets a proper diagnosis, I don't know what staphylococcus means, and let her go and get properly tested. Let her see a doctor and lay these complaints. Then she will know what she's talking about.
Okay, thank you very much. Snowizy is in the house, but Snowizy, private chat me on this live stream. Send me a private chat, Snowizy. I'm going to send the link to you to join our stream. Please send in private chat me, and then I'll send you the link. So somebody is saying, please, sir, which drugs can I take to boost my ovulation? Madam, I'm sorry, we cannot prescribe any medicine for you.
Is it me or the internet has broken?
Okay, okay, we are back. Sorry, my network.
Okay. Okay.
Yes, yes, yeah. Okay, guys, welcome. So, madam, for those that are just joining us for the first time on this platform, we don't prescribe medicines here. I beg you. Don't look for medicines. We're not going to prescribe any medicine for you. We're just going to advise you. Is that okay? Hmm? Yeah. Can I get your number, please? No, ma. I'm sorry. I don't give her my number. I'm sorry. I'm sorry. Unless my doctor here wants to give you his number, but we don't do that. We don't give out our
Yeah.
numbers on social media unless you want to have a private consultation. Then you can book for a private consultation. Other than that, I don't give out my number, please, because if I give out my number, everybody begins to call me, and we don't do that. Let's go to the next question. Doctor, please, I'm pregnant and I'm bleeding. I'm going to the hospital. Time without number. It's 17 weeks now. Please help me. What would you advise her?
So if you are bleeding and you have been to the hospital, you need to see a specialist. Go to a proper. The hospital may be run by whoever. Go and see a specialist. Number one, they will ask you some questions. Number two, they will recommend bed rest for a number of weeks. But you need to get a specialist to look at you. I don't know the kind of hospital. I don't know who's looking at you. Get a specialist to examine you and do the proper history taking. That bleeding is not normal. You may need bed rest. You may need some other things, but see a doctor.
Or permit me to add, if you have gone to the hospital, you have seen a doctor, and you have not seen a gynecologist, an obstetrician, I think it's important you see an obstetrician right now to help manage you. Please, you are
Exactly.
17 weeks and you are bleeding. It's not right, madam. So try to see an obstetrician in case you haven't. EC, I see you. EC is a very good supporter of my page. For those that always support my page, I always give you a shout out whenever I'm live on the stream here. So EC, I see you. Good evening, doctor. What medicine can I use to treat watery sperm? Doctor, please
What medicine?
respond.
What medicine?
Please respond.
Guys, ladies, gentlemen, let's stop this idea of shortcut microwave medicine. If you have reached the diagnosis of watery sperm, then whoever made that diagnosis should need to give you counsel. You need to see your urologist, you need to see your specialist and find out what exactly is watery sperm. We are not roadside dispensaries or dispensers. If you say it's watery sperm, who gave you that diagnosis of watery sperm? That person should be able to tell you what caused the watery sperm through examination, through history taking, and then run some tests. So I don't know what to say to that question, and I can't answer that question really. What is watery sperm? Who gave you that diagnosis of watery sperm? What does it mean for sperm to be watery? See a urologist, see a specialist, get details, get investigations done, sit down, let them check your history. Then we'll begin to find a solution. But if you say watery sperm, I can't relate to that statement. I'm sorry.
Yeah. Thank you so much. I can see Dr. Snoweezy already trying to join us. I see you. So, Dr. Snoweezy, yes, I think you have the link. Do me a favor, edit your name, add doctor in front of your name because this live stream will be up, and anybody that sees you would also see your name, so that if they want to find out, want to reach out to you, they know how to search you out. You know? So when you're joining back on the live stream, please just put your name so they will see your name, like Dr. Tim talked about here. Let's see. Somebody says, see questions again. Oh my God, these are questions are so much. Please, share this live stream. Don't forget to send stars on Facebook and YouTube. Okay, I met the doctor last 3 weeks ago. He gave me the drugs that have a degree of sensitivity to the bacteria. So I went for test again. It's still showing moderate growth. Okay, praise Diamond. If you can hear me, praise if you can hear me, relax your mind. Um, Sometimes you might see your test showing you moderate growth. Continue. As long as you don't have any symptoms, please continue. Live your life. Later on, you can go see your doctor again. Do you understand? So praise, stop panicking. And I don't really know why. I don't know why you did the test in the first place. You understand? I don't know why you were being managed for staphylococcus in the very first place. But I beg you, stop panicking. Okay, my doctors are here. Let me bring you back. Dr. Snoweezy, if you are ready, give me a sign and
Okay.
then I will
Yes.
bring you up. Okay.
Sorry,
So somebody
I logged
say,
myself out.
okay, okay, for the leg that is bleeding, the doctor said it's going to be okay. But up to now, there is nothing. Oh, really? Okay, try to see an obstetrician, please. Try to see an obstetrician, madam. An obstetrician is a doctor specialized in the management of pregnant women. Yes. Try to see an obstetrician. Somebody is asking us, what I have been treated for UTI, but it still persists. What would you advise, please?
So, okay, that's an interesting one. For persistent UTI, and you've used the right medication, you say the doctor, they've examined you. Let's do other things. Add, how is your personal hygiene? Are there multiple sexual partners? Personal hygiene usually answers most of these persistent UTI problems. Have you gotten examined? Is there a problem? And the person doesn't say if it's a male or female, but I assume it's a female. So when I say personal hygiene, how do you wipe? What kind of underwear do you wear? Do you have multiple sexual partners? Do you have underwear that are not 100% cotton? Do you take care of your underwear properly? That is, most women will dry their underwear in the bathroom in the humidity. So you are allowing those organisms to grow and come back. So How frequently do you change your underwear? Are there discharges? Are there pain? Or is there pain? So when you can answer all these questions, especially personal hygiene, you take care of most of these things. Have you done an HSG? So there are investigations you would do, eye vaginal swab, HVS. So there are other things you can do to find out exactly where is this recurrent UTI coming from. It's really important that you do these investigations and look at your own personal hygiene too.
Very good. Okay, so let's go up to the next question here. If you are just coming, you are welcome. If you are joining us on Facebook or YouTube, welcome. Don't forget to share this video. What are the signs of breast cancer? Miss Vicky is asking us the signs of breast cancer.
Oh wow. The first sign is no sign. Sometimes you don't have any sign, it doesn't give you any warning. The first sign. Second sign of things that you may see. So when I give a list of these things, it's not in all cases that you see. Like I told you the first time, you may not see anything. Number one, the skin may change. You may feel the skin changing, looking like an orange. There may be swelling, there may be pain, there may be no pain. There may be hardness. The nipple may be pulled inside. Like instead of nipple to come outside, it pulls inside, retraction. The breast may be different, remarkably in size. That is, this one is getting bigger while this one is small. There may be pain in the armpit. There may be loss of weight. There may be discharge. Remember, I'm using the word may be, so it's not in all cases. So many symptoms can occur as breast cancer. But we tell women, know how to examine your breasts. It's called breast self-examination. I've done a video on that before. Because of time, I don't know if you have enough time to describe BSE.
Okay, let's do that quickly because we have so many questions.
So you're a woman. You are the one that looks at your breast. You know how your breast looks normally. So every morning, you take your hand, put it at your waist. Of course, you're dressed down. Examine yourself in front of the mirror. You're looking at, is there any skin changes? Is there any swelling? Is there any color change? Is there any pain? The next thing is that you want to examine each breast. So I'm going to turn my camera to my chest so that you see. And I'm going to do it for one breast because of time. So you divide, in your mind, you divide the breast into four. We call it quadrants. With the flat of your hand and the other hand, for instance, I want to examine my right breast. This is my right. My left hand goes behind my head. I use the flat of my hand to examine 1, 2, 3, 4, 5, that is around the nipple, and 6 towards the armpit. I'm checking for swelling, I'm checking for pain, I'm checking for hardness. I want to squeeze the nipple to see if anything discharges. Anything you discover, get to your doctor and get the proper test done. You can do the same thing for the left hand. I hope that helps.
Yeah, thank you, Doc. So there are so many signs of breast cancer. You can have swelling, pain, itching, discharge. You can have a mass. Do you understand? A painless mass in your breast, or painless lump. You can also check your armpit. So it's important that every woman listening to us here, you know how to examine your breasts. Okay. Let's see. We have so many questions here. If you are just coming, please don't forget to like this live stream, share this live stream, send stars on Staphylococcus. Finally, please, does Staphylococcus aureus get out of the system completely? Hearing so many myths about it, can it be cured? Please go to my page. I have made a video on Staphylococcus. Go and watch it. Go to my page on YouTube. Your name is what? Praise Diamond. On YouTube, I have a video on Staphylococcus. Watch that video. Everything you need to know is there. Yes. Please post the link to calculate ovulation. It's on YouTube. Blessing Ofogba. I did also make a video on how to calculate your ovulation. The video is on my YouTube page. So just go to YouTube, search for Doctor Fredostar. You will see it. This person is telling you Dr. Fredostar have video on that topic already. These people follow me very well. Good evening, sir. Is it normal having abdominal pain and nipple pain during ovulation period? Oh God. I have made a video on ovulation too. It's on Facebook and YouTube. People don't watch these videos.
That's what I said about microwave. People don't want to watch your video. They just want to come and get the answers and go away.
The video is there already on Facebook. Okay, let me bring Dr. Snowizi. I hope his audio will be good. Dr. Snowizi, good evening. How are you?
In.
How you day? How you day?
I'm fine. Can you hear me?
I can hear
Yes,
you
we can hear you loud and clear.
Yeah.
Okay. Thank you, Dr. T, for.
Yes.
No,
As in,
no problem.
This live stream just the cast they go. So see doctors everywhere. Okay, so for those asking us on ovulation, there's a video already on that. Somebody's asking us a question. What can I use for what in my private parts? Please respond, Dr. Otimtope, then Dr. Snowizi.
So I'll still send you to your doctor. I'll still send it to your doctor to examine you. What do you mean by what? I would not give you prescription. Your doctor will examine you and tell you what kind of lesion, that is what kind of thing you are calling what. There's so many people call it what, it may not be what. And if it's what kind of what is it? So you see your doctor, see your specialist, and have it examined. That's way he cannot or she cannot tell you, use this, use this, use this. I do not prescribe, and I know Dr. Fredostar does not. This is not a mobile chemist.
So, Dr. Snowizi, please respond also.
Such a person, and if you meet a good physician, he also tell you what to do at the same time. Yeah, so I agree.
Okay, very good. So let's respond. What is the cure or remedy for early stage of breast cancer? Dr. Snowizi.
Early, you're already seen, okay, a general surgeon. This is a cancer, and you're already seeing a doctor. Okay, so whatever rather talk about is how to actually detect it early. And I think when self-examination, BSc. So that's one very helpful thing. Then if you are both mammogram, that will also help you detect early, because sometimes there can be no sign, like any sign, and it just comes up. So regular checkup is key to find it early. And if you found it here.
Okay, thank you very much. Wow, well, the network for Dr. Otimtope is acting up. Okay, we have another question here. And the person says, please, can somebody be pregnant and see her ovulation? Dr. Snowizi, let's react quickly.
Okay, so you are pregnant and you are seeing ovulation. I am actually wondering what triggered this and still see your period. And my answer is always no, because if you are pregnant and if you are bleeding in pregnancy, if you are bleeding and you are still seeing your ovulation, I don't think that's likely. Some people have tried to. Things are not so common, but ideally, it's not expected, because it means what it means that if you see your ovulation while you're pregnant, do you understand? So ideally, it's not supposed to be so. All right.
Let me just quickly also react to that. Ovulation means that you are trying to get pregnant. You are releasing an egg. You understand? You want to get pregnant. So your body is releasing an egg. So you can't be pregnant and at the same time, your body is also releasing egg again. If this would ever happen, it might be 1 in 100 million women. Do you understand? So it doesn't occur. Ovulation occurs before pregnancy. And when you are pregnant, the hormones that your body would secrete would not stimulate your ovaries for you to ovulate. Do you understand? Yeah. Good evening, Doc. What is the cause of swollen leg after sitting down? Dr. T, you want to respond to this?
So I don't know what this person is, probably a female. So swollen legs after sitting down. I'll explain it this way. Your heart pumps blood out of the body through your arteries to all your parts of the body. High pressure. But when the blood is going back, it goes through low pressure through your veins. So when you sit down in a certain position and during long periods, these veins are disturbed from returning blood to the heart. So what happens is that the blood in those veins, because they're not returning to the heart, they now move into your tissue through the blood vessels, and accumulate those fluid in your leg, in the blood vessel. So what you're having is accumulation of blood, and the fluid, the water part of the blood, is coming out of the blood vessel into your tissue. I don't want to use technical names so it doesn't get you confused, but what usually helps is, number one, you raise up your leg to a higher stool or something when you're sleeping, or put extra pillow when you're sleeping under your legs, or take a walk, especially for pregnant women. So to help that blood flow, muscle contraction, everything will help the blood flow come back. So your blood vessels are blocked when blood is returning to the heart because the blood pressure is lower. That's why your legs are swollen.
Dr. Snowizi, you want to react? Add one or two to this.
Yeah, so basically what Dr. Kia said, if for any reason you find that aside sitting down, you still have swollen legs, then you may need further investigation. Fine, still find that your legs are too swollen. Okay, still go to the hospital so they can see you and then find that also be having that.
Yeah. Thank you. Somebody's asking us a question here. Good evening, sir. Please, I don't know how I contacted on toilet infection, but now I find out that I have it and I'm worried for my boyfriend. What can I do? Madam Isiaka Grace, you are watching us on YouTube. Very good. So my advice to you is right now, please leave this live stream. Go to my page on YouTube. Look for my video on toilet infection. There is nothing like toilet infection, madam. Please go and watch the video. I don't know where we usually get this notion from. There's nothing like that. To help you, there's a video on toilet infection on my YouTube page. Watch it. But before you go, let's hear from Dr. T if he has anything to also say.
So I also do not know in my practice, no topic in medicine that was called toilet infection. Go and see your doctor, get investigated, give that your toilet infection a name so that they can know where it's coming from. Then you cannot talk about treatment. Get examined, let your boyfriend also get treated and let him go along with you. So get examined, get investigated, then get treatment. There's nothing like toilet infection except on the streets outside.
There's no easy. Is there anything you want to say to her?
So I agree with them. There's not a toilet infection, but still keep the toilet clean anyway.
Yeah. Keep the toilet clean. Okay, so we have a question here. What can make let's see, what can make a man to ejaculate during romance?
Yeah.
Dr. Snowizi, are you there?
Yes, I'm here.
Okay, let's go.
This person is trying to describe a situation where the man actually ejaculates. So it's having some form of premature
ejaculation.
The reason why the man ejaculates too quick. And that's the question. Top of my head right now is if the man have stress at work and cause it. Before now, he wasn't really like that, but all of a sudden he started having such things. Stressors can cause. If he has any form of diabetes can cause that also.
Yeah.
It might be would depend on it varies. I don't really know the person in question. I'm just giving possibility.
Yeah.
So I can tell which one is actually worrying him. It could be psychological also.
Yeah.
Possibility.
Dr. T, do you want to add anything?
Yeah, so I think I had a session on premature ejaculation some months back, and there's a list of things. The best thing is sit down with your doctor. The doctor will go through that list and find out the one that pertains to you. Anxiety, stress, masturbation sometimes, diabetes, some neurological disorders. So many things can give you the kind of at what stage of life you are age-wise. So many things can give you this, but you need to sit down with your doctor, open up to him or her, and have that discussion where the doctor can pinpoint, oh, this is where the problem is. Then you can now work towards the solution. There's so many things. I can remember the list in my head. There are so many things that I listed.
Yeah.
I hope that helps. Just discuss with your doctor.
Okay, before we continue, I noticed something. People are not sharing this live stream. Number one, nobody is sending stars on this page, but everybody wants to ask questions, want to private chat. No, now, make una they share, make una they send stars. Abi? Okay. And then somebody says, I'm watching you from Italy. Thank you very much. Um, okay, we have a question here. It says, can oral sex make a man have cancer of the throat?
Mm.
Can oral sex? Okay, see, this is how it is. Oral sex can, yes, actually give you so many type of cancer, not just cancer of the throat, even cancer of the mouth. Because oral sex, you can get HPV. HPV is a virus that you can get through oral or genital intercourse. So if you meet a partner and your partner has this virus and you are not screened, and your immune system is even very poor, your immune system cannot handle the virus or suppress it, there's a very high tendency that you can come down with oral cancer, cancer of the throat, penile cancer, anal cancer, cervical cancer. So it's
Yeah.
possible. Dr. Snowizi, you want to add anything to this before we go to the next question?
Yes. So just in addition to that, like I like stressing on TikTok, condoms does not protect you from HPV. Because
Mm,
some persons think that once you just use condoms, they are safe from everything. Still at risk of that.
mm. Okay. Good evening, doctor. I'm 37 weeks pregnant. I always feel pain in my vagina and my lap. What advice do you have for lovers?
Well,
Okay, still on me?
Okay, go ahead.
Okay, so you're
Dr.
37
Sandwich, go
weeks.
on, please.
Okay.
Likely happening now, most likely, okay, is that if your baby is already coming down, tendency there's a lot of stretching, there's a lot of pressure, okay, towards your VJ and towards your do well. I don't really know what else you could do because what we want to achieve before you to deliver, unless you don't want to deliver, but I don't really know. If I just want you to know it's normal. It's not like there's anything wrong with you. You understand? It's just the head coming down. If it's coming down with the head or coming down with the buttocks, all of that going on, and your labor will most likely be close.
Okay. Yeah. Let's go to another one. Okay, we have a few more minutes and then we'll be done for today. Doctor, is it normal for period to come 2 weeks after the last one? Okay, Dr. T, you want to respond to this?
Well, it's not normal, but it's not unusual. What it means is that you have a short cycle. So you need to speak to your specialist, your gynecologist. Let's find out why your period is coming so early. The shortest from research, from study, is supposed to be 3 weeks. That is 21 days. So if you're having it less than 21 days, that means you are probably having intermenstrual bleeding, or you are having frequent menses, which is not normal. So as a short answer, it's not normal. See your doctor. Find out, are you bleeding like normal bleeding, or are you spotting? Was there any trauma? Was there any sexual accident? Was there any other thing that happened in between that could have caused the bleeding? Or see your gynecologist, see your specialist, and discuss. Bleeding is not supposed to come that frequently. So it's not normal.
Dr. Snowizi, you want to add anything to this?
And in addition to that, the shortest 21 days, at most 35 days. So if you have periods, it's also not normal. Also look into if you use contraception. Maybe some people like using stuff like that. You can also mess up your cycle.
Mm. Okay, we have a comment here. Let me respond to this one specially. The person says, "Doctor, you know they come YouTube. Oh. Okay, no vex. Sorry, but let me announce to everybody here. I'm going to have a special live session on YouTube. It will be for only members, those that join my membership, so we can have a private YouTube live stream. It won't be for everybody. So if I have only 5 people in my membership, we can have the live stream. It will be for the 5 people there. We can interact, we can have more sessions over there. So I would encourage you, for those on YouTube, you can join my membership and I can give you the updates to know when we'll be going live, and we'll have more discussions there. So no vex, we are live on YouTube and I'm taking all your questions. No vex. Um, Good evening, doctors. What could possibly cause a person's body to readily react to cold at all times? They don't like any form of cold, whether it's breeze, fan, AC, and they can't even use cold water to bath. Ha, Sarah too. So for a case like this, someone can't tolerate cold, though the weather might be warm, but this particular person is complaining that he or she is very cold. It points our mind to issues that might relate to the hormones sometimes, or the thyroid. So I would advise that this person see a doctor as soon as possible. As soon as possible. You can't really manage this at home. Dr. T, you want to add anything to this?
Yeah, I'm very much on that line. Cold intolerance, especially when everybody's saying it's hot and you're the only one complaining of cold. Then you're not born to be from UK. If you see your doctor, it may be a thyroid problem, maybe some other problem, but I'm looking towards thyroid. So you need to talk to your doctor and examine and do your hormone profile and do some other things, and let's see what exactly is causing that change. So that's what I'll say for now.
Dr. Snowizi, you want to add anything to this?
So in addition to that, just don't tolerate certain things generally. Okay, if you don't know the investigation, you find out that, oh, there's nothing wrong with you. It's just that your body does not like it. It's just as simple as that. If you do this thing and it does not go well with you, avoid it. That's just it.
Okay. How many more minutes do we have? We have a few more minutes and then we are done. God. Please, is there other treatment for varicocele without surgery? Okay, let's react quickly.
Very good. Hello, can you hear me?
Yes, yes, I can hear you. I
Yeah,
can
we
hear
can
you.
hear you,
Okay,
bro.
for varicocele, the decision to operate depends on the severity. Active mobility. It's not like you're having issues procreating or anything. Nobody really tries to intervene. They want to solve. So for me, I don't know of medication. I only know of surgical intervention.
Okay, Dr. T.
I have no other thing to say other than by the time Dr. Stowizi has already said it. By the time you are looking at varicose and it's already symptomatic, then depending on the severity, surgery is usually the only way I know. Or you can decide to leave it, but it has its own complications too.
Okay, doctor, I ovulate on the first day of my period. Is it good? Rita, you can't ovulate on the first day of your period, madam. There is no woman that would ovulate on the first day of her menses. That is her period. You are bleeding. You are seeing your period. Blood is coming out, Abi. No, madam, you can't ovulate on the first day of your period. Even if you have a 21-day cycle and you have a 5-day menses, you might ovulate on the 6th or the 7th day, but on the first day of your period, madam, you can't ovulate. Yes. Let's respond. Snowizi.
Yes, I totally agree with you. It means the person has a 14-day cycle and he's not likely ovulating.
So I would tell people to I think Dr. Snowizi has a video on signs of ovulation. Most of the questions you guys are asking, Dr. Fredostar has a video for it already. So let's make sure that you are really ovulating. Go watch his video. check yourself for those signs. It's not possible for you to, unless that's not your ovulation, unless not ovulation, and that's not the beginning of the cycle.
Yeah. Dr. T, let's respond quickly. Good evening, doctor. My daughter has been having frequent chest pains. What could be the cause?
Madam Idobong Boha, it is not possible for me to know. I've not examined your daughter. I've not seen your daughter. I can only give you, I don't know the age of your daughter. I don't know what country she is. I don't know what she's exposed to. I don't know her family history. I don't know who smokes around her. I don't know the kind of activity involved. So go and see your doctor. These are questions that they will ask you word for word. Well, how's the birth? How old is she? Is she having any is any problem with her genotype? Is she exposed to cold? Does she stay where there's dust? Does she have any other chest diseases? Has there been any time that she has been hit in the chest? Has there been any time that she's exposed to smoke or anything? So please see your doctor. Sit down and let them take proper history. Let them look at your daughter's chest and do investigations if necessary. Then they can begin to give you diagnosis for the age, for the location you are, for the kind of exposure the child is having, and the rest of them. I'm not a magician.
Dr. Snowizi, you have anything to add to
Okay,
this?
so but one thing I can tell you for sure is that chest pain is not a symptom of the hospital. Yeah.
To go to the hospital. I have taken drugs and injection for Staphylococcus aureus, but it's not going. Oh my God. This Staphylococcus again. What it be this? What it be this?
Staphylococcus must hear word today.
It is there.
Where do you people keep getting this from? I believe that a medical doctor did not make this diagnosis for you. You are making the diagnosis at the roadside because it's actually a medical doctor. He will advise you on what to do. So, madam, who are you saying? Who is giving you the injection? Snowizi, please respond.
Okay, so basically what you're saying on lab investigations to determine if they are fully cured. You go to the they want to give you. You do the test again, it's still remaining small. It's remaining small. They'll give you more drug. It's remaining small test and not the patient. And one thing that's very obvious is that staph aureus is a common contaminant. Okay, you'll be surprised the kind of thing you will grow. So staph aureus is a common contaminant. So I don't really, when someone say it can come from anywhere. Are you symptomatic? Do you actually have complaints? Tell us your complaints. Don't say I have staph aureus and I've been treated.
Dr. Timitope, want to respond?
So staph aureus exists almost everywhere. It exists on your skin. It exists everywhere. So anyone handling your investigation, like Dr. Snowizi has said, I'm going to be treating you based on those symptoms, those signs I can elicit, not based on one sheet of paper. So who's treating you? Who's giving you those diagnoses? We don't treat staph aureus. We are looking at what symptoms, what signs, what are those things that you come down with. I will now tell you, okay, this is what you may need at this next thing. So I don't know how to answer that question really.
Okay. To know more about Staphylococcus aureus, if you want to know more, to have more understanding, there's a video on this on my page. Is there any health implication? Hey, Ajayi. Ajayi, how are you? Ajayi, long time. How are you there? How's your family? So this is another person that supports my page very well on Facebook. Yes. Ajayi, it's been a while. How are you? Is there any health implications for swollen legs as a result of sitting down for a long time? You are advised not to sit down for long because when you sit down for long, there's pooling of fluid. If you travel or if you take a long flight, they tell you sometimes do not sit down for too long. You can try to walk around because when you sit down for too long, there's pooling of fluid. Venous return is reduced. So you move around. It doesn't mean you have a problem. But if you notice that you are having swollen legs, even when you are not sitting down, at other times you are lying down, you are doing your normal activity, you are seeing your legs swollen. then you have to go to the hospital to see a doctor. Very important. Or if I sit down for the whole day, my legs can get swollen. Doesn't mean that I have a problem. You understand? So it happens because you are sitting for a very long time. So we advise again, do not sit for too long. Sit down for 2 or 3 hours, get up and move around. But Dr. T, you want to add anything to this?
Yeah, that's it. Like I said, if your legs are getting swollen without you sitting or staying in one position for a long time, the doctor will not ask you, oh, do you easily get tired? Or is there difficulty breathing? Are people pressing you at night when you are sleeping? Those are the questions they will ask to lead to what exactly is causing the swollen legs. So see your doctor, but don't sit down for long periods. Let's remove that from it. You can walk briskly, you can exercise, you can do a little movement, maybe for 15 minutes, then go back and do your sitting. No boss in the office will tell you sit down at a place for 8 hours directly.
Okay, let's take the next one. We are rounding up right now, guys. But they said that it's normal to have swollen legs in pregnancy. We are not talking about pregnancy here. This is not about pregnancy. Women who are pregnant can develop swollen legs from time to time. But this is not pregnancy here. This is something totally different. You want to add anything? Snowizy?
So, okay.
Your blood pressure. It's normal. You have concerns about your blood pressure. You have a blood pressure checked.
Yeah.
Okay. Dr. T, let's add. Ladies and gentlemen, we are rounding up.
Yeah, so what I wanted to say is that even in pregnancy, remember I said the blood coming up is blocked by your sitting position. Also, the baby's weight will block some of those vessels from returning that blood. That's why I talked about putting your leg under extra pillow on the bed, taking walks, sleeping on your side to allow the weight of the baby to shift from those veins that are blocking your blood vessels from coming back, or bringing the blood back. And also, Dr. Sonji has mentioned it importantly, you need to monitor your blood pressure. But see your doctor and he'll give you further investigations and things to do.
Okay. We really have to end this thing. The questions keep pouring in. And I don't know, we cannot respond to everybody. I also don't ovulate. How do you know you're not ovulating, madam? How do you know you're not ovulating? Eh? Have you seen a medical doctor and you are told that you are not ovulating? This is very important because some women will tell you that they are not ovulating, but actually they are ovulating. You get. So it's important you see your doctor so that your doctor can actually confirm for you. See a gynecologist if you feel that you are not ovulating. And somebody says, Doctor, please answer me. I really want to answer you, Ajayi, but I'm not seeing your question because I know you. You always support this page well. So I would like to respond to your question, but I'm not seeing it again. I'm not seeing your question. We have to. I hope we'll be able to have this session again. This is about 45 minutes a live session here, and we had three medical doctors on the live stream. From time to time, more people join us. More doctors will join us. Also, from time to time, I will also share the link to you for those that want to come up online and ask questions. We'll send the link to you. But we have to go right now. Also, for those on YouTube and those on Facebook listening to me, you can join my YouTube membership. We can have a private live session there. There we can respond to your questions. But on this general platform, we are time bound. Dr. Snowizi, any final words?
Thank you for having me. It was fun being here. Thank you, Dr. T. Appreciate
Yeah,
you.
yeah, Dr.
Yeah, no
T, any
problem, boss.
final words?
I want everyone to understand one thing. When you go and see your doctor, whatever you're complaining of, most of the time it didn't start that day. So when you're given a medication, make sure you complete your dosage. Don't expect microwave solution. Doctors are not magicians. Those drugs will take time to work. Adhere to common instructions about your health. Dr. Fredostar has done a fine job posting short videos that even if I have a short attention span, which I do, I can watch them to the end and still get what I need from it. So please use your medications, watch his videos. Almost every question that you have to ask here are already represented on his videos. And I hope you stay healthy. Good life now, Senso.
Yes,
Good life,
so
my friend.
yes, so good life now really says thank you, Dr. T, Dr. Snowizi, thank you very much.
No
And to
wahala.
those that we
No
didn't
wahala.
respond to your questions, I beg no vex. We know if we stay here, also we go the answer, and we know go fit comot. So make una no vex. Thank you for joining. Those that joined us on Facebook and those that joined us on YouTube, we say a very big thank you to you, and I hope to see you some other time. Remember, good life. Good life nonsense. Nonsense. Take care, guys.
No
Bye
wahala.
bye. Thank you, everybody.
Okay.
Bye bye.
Bye bye.
All right, bro.